We begin today with a new frontier in the forensic science arena, forensic nursing, described as the link between the healthcare system and the law. And forensic nurse Julie Valentine joins us here in studio. Thanks for your time.
Thank you for having me.
So let's get started with, for people who are unfamiliar, how do you describe forensic nursing? What do you tell people you do?
Forensic nursing is caring for individuals who have been impacted by violence or trauma. So it extends everything from sexual assault, child abuse, elder abuse, to traumatic events such as the earthquake in Turkey and Syria.
Fascinating. Would you describe yourself as more forensic scientist or more nurse?
Definitely describe myself as more nurse. Nursing has a very holistic approach as to how we care for victims, our patients. And so when we are caring for these individuals impacted by trauma, we look at all the aspects of how this trauma has impacted their life. Part of that is the forensic aspect.
I think when people think of forensic nursing, their first thought is to think of, administering the kits to maybe a sexual assault victim. How do you utilize forensic nursing when it comes to, like you mentioned, those earthquake victims in Turkey?
So forensic nursing, the majority of forensic nurses are sexual assault nurse examiners, and it actually has been around for 30 years, forensic nursing. But it also encompasses psych, mental health, expertise in trauma-informed care. And so it goes across the board, and we also care for people across the lifespan.
We talked about forensic nursing is sometimes described as, where forensic science meets the law. How important is the data that you gather in a hospital setting when it comes to the courtroom?
So the forensic information or evidence that we collect from a victim, the importance can vary. I have cared for some patients where the evidence that I collected was the game changer. That helped to identify the perpetrator, or it really was necessary for that crime to be charged and then move forward throughout the process. But we have to consider that generally it's part of the puzzle piece of looking at what happened in a crime. It really is using science to inform criminal justice.
I would think that's very fulfilling for you as a nurse to see, obviously you take care physically of the patient when they arrive, but then to be able to see, the end of their case all the way through fruition, see that perpetrator be held accountable, that is also treating their mental health aspect as well. That has to be very fulfilling.
It is. It's fulfilling to see those cases move forward. The sad part is that we, in terms of rape, see very few of those cases prosecuted, even when evidence collected. And that's an area that we need renewed focus on.
You were a nurse for a very long time before you got into the forensics nursing arena. What was it about that was attractive to you? Why did you want to pivot from traditional nursing?
Well, I think healthcare and forensics have some commonalities. They both are using science and evidence to provide the best care, to develop evidence-based practice guidelines. I was intrigued as an old ICU nurse as to the science and the rapidly changing technology and developments. And also I felt very compassionate towards these survivors of trauma and felt that I have this time in my life for me to care for patients, and I can probably make more of a difference caring for these individuals impacted by trauma than anywhere else.
Final question for you. Biggest obstacle or challenge that you face in this field?
Biggest obstacle or challenge is not enough forensic nurses. We need many more forensic nurses. Every hospital needs a forensic nurse. We need more education in forensic nursing. I'm talking about traditional nursing programs, not just specialty forensic nursing programs. But forensic nurses are educated in how to best care for these victims of violence and trauma, and to collect the best evidence. And so we need more.
You mentioned that forensic nursing has actually been around for quite a while, a long time, but it is just finally being recognized, as a section of the AAFS. That has to feel good.
Absolutely. It shows the growth of forensic nursing, and it also validates the importance of forensic nursing.
Well, the work you do is very important, and so we certainly appreciate it. Thank you.